USMLE style question. A 5-year-old boy is brought to the pediatrician due to recurrent episodes of easy bruising and prolonged bleeding after minor injuries. His parents note that his gums bleed excessively when brushing his teeth. Physical examination reveals multiple ecchymoses over his lower extremities. Laboratory findings are as follows. Platelet count, 120,000 mmHg, mildly decreased. Bleeding time, prothrombin time, PT, normal. Activated partial thromboplastin time, aPTT, normal. Peripheral blood smear, giant platelets. Which of the following best explains the pathophysiology of this patient's condition? A. Defective glycoprotein 2b3a receptor. B. Deficient von Willebrand factor. C. Defective glycoprotein-IB receptor. D. Impaired ADAMS13 function. E. Autoimmune platelet destruction. Answer: C. Defective glycoprotein-IB receptor. This patient has Bernard-Soulier syndrome, BSS, an autosomal recessive platelet adhesion disorder caused by a deficiency of glycoprotein-IB, GpIb, which is necessary for platelet binding to von Willebrand factor, vWF. As a result, platelets cannot adhere properly to damaged endothelium, leading to prolonged bleeding time and defective platelet plug formation. Key features of Bernard-Soulier syndrome: clinical, mucocutaneous bleeding, epistaxis, gum bleeding, easy bruising. Labs, prolonged bleeding time due to defective platelet adhesion. Normal PT and aPTT, coagulation cascade is intact. Thrombocytopenia with giant platelets due to defective megakaryocyte fragmentation. Why the other choices are incorrect? A. Defective glycoprotein 2b3a receptor, Glanzmann thrombasthenia, platelet aggregation defect, normal platelet morphology. B. Deficient von Willebrand factor, von Willebrand disease, abnormal ristocytin test, increased aPTT in severe cases. D. Impaired ADAMTS13 function, thrombotic thrombocytopenic purpura, TTP, microangiopathic hemolysis, fever, renal neurosymptoms. E. Autoimmune platelet destruction, immune thrombocytopenic purpura, ITP, isolated thrombocytopenia, normal platelet size. Key takeaways: defective GpIb, decreased platelet-vWF adhesion, mild thrombocytopenia with giant platelets, prolonged bleeding time, normal PT-aPT, differentiates from Glanzmann thrombasthenia, GpIb 3a defect, no giant platelets,